Suicide rates have risen yet again, with 685 people dying by suicide in the past year. That's 17 more lives lost. The number of Māori taking their own lives has increased 19% on the year previous, and the Māori suicide rate is more than twice the rate of New Zealand Europeans. Here's the Prime Minister, Jacinda Ardern.
There is no question that our suicide rate is too high. There is no question that as a government we have to put our all into turning that around. It is one of our biggest long-term challenges as a nation, not just as a government, as a nation. But I ask the question as to whether or not a target would have the effect of causing that number to go down. And no one could produce any evidence to me that a target would do that. And I was concerned, and so was Cabinet, that a target implies that we have a tolerance for suicide, and we do not. And so that is why we made the decision that we will continue to focus as a government, as a country, on bringing that rate down. But for us, of course, the goal has to be no one lost to suicide.
These provisional figures were supposed to be released by the Chief Coroner at midday tomorrow, but the Māori Council forced the Justice Ministry's hand by breaking the embargo and going public with the figures. It says they are a national disgrace. Joining me now is Matthew Tukaki, who is the Executive Director of the Māori Council and who is the man who released the figures today. Can we start with that, Matthew? Why did you break the embargo and put these figures in the public domain ahead of time?
So, first of all, I fundamentally believe, and the Māori Council fundamentally believes, that these are the stories of our people, and not only our people, all New Zealanders. What's happened over the last week is that the Ministry of Justice has managed to distribute this sort of data to mental health service providers, organisations and individuals. And by the end of last week, I formed the view that what was happening here was the creation of a narrative to try and dumb down what the truth of the data was telling us. So I wasn't involved in the distribution of that data or that information from the Ministry of Justice, nor was the Māori Council, but it was provided to us. After a hui this morning with Sereti Jury, the Chairman of Māori Council, the Deputy Chair of Māori Council and myself, we decided it was time to act. And it was time to act because we need to give our people, give all New Zealanders the firm understanding here that the data in absence of a plan, and I hear what the Prime Minister's said, Lisa, I really have. I'm not a great believer in the setting of these targets as well. I mean, I'm the former Chairman of Suicide Prevention Australia. I know this sort of thing really well and back to front. But where is the plan? And here's the reality of the situation we face. New Zealand has been without a national suicide prevention strategy and plan since 2016. It has been the failure of the previous government, and we're now moving into a rolling train wreck of a failure not only for Māori but all New Zealanders, again in the absence of a plan.
So, just to be clear, you thought they were going to spin these figures, is that what you're saying?
Absolutely, I thought they were going to spin these figures, and that realisation has proved to be accurate when we've seen a plethora of now press releases coming on the tailcoat of the Ministry of Justice and the Chief Coroner's release of the data not too long ago. It always makes me, quite cynical when I see the press releases all time to go at the same time. Now, obviously, it wasn't necessarily my intention to force the Chief Coroner into a corner or a position, but here's the thing. 10 minutes after the release of the data from the Māori Council, from me, we received a phone call from the Ministry of Justice making threats. Now,
what kind of threats?
I said to them, first of all, they said, how dare we release judicial information? How dare we do this? How dare we do that? And I said, well, hang on, what are you telling me? Are you telling me that you will arrest me? Are you telling me that you will prosecute both myself and the New Zealand Māori Council? And then as we went through this conversation, I discovered that this was a member of the Ministry of Justice's media unit. Well, I'm sorry, media unit, you do not get to shape a narrative around what is a rolling feast of a national crisis when it comes to suicide.
Okay.
And let me just point out, if I may, just quickly, we are now talking about the Māori suicide rate per head of population jumping a massive 5% per 100,000 population. Now, to put that in a global context, we are now leading that trophy cabinet. And for my people and for our whānau right across the country, and I dare say I would speak for all New Zealanders on this issue, that is not a trophy anyone wants in their cabinet.
So who has let Māori down then, specifically?
Well, first of all, I would go right back to the previous national government. It was under the stewardship of the minister then, Jonathan Coleman, and I remember having conversations with Jonathan in November of 2016, putting forward recommendations on how we might shape this plan together, and not just me, myself, and Jonathan Coleman, but Māori in general, and it was knocked back comprehensively.
But you have a new government now, Matthew, and they have put $1.9 billion in the budget going towards mental health services, including $445 million for frontline staff and services, where they hope to see about 325,000 people go through that system. They are throwing big dollars at this.
Are they? Are they throwing big dollars at what? What is the plan? There is no national suicide prevention strategy. There is no obvious investment at the moment in building a workforce, for example, that is fit, willing and able to respond to what is obviously not only a national crisis, but the demand of people seeking help. There is no workforce development strategy. There is no service delivery model. And by the way, mental health is not the only thing going on here. Suicide, and it is proven by the evidence and research right around the world, is not just about those people with a pre-diagnosed or diagnosable mental health condition. It's also about people who are facing the daily struggles of life, relationship breakdowns, homelessness, all of these different things that ultimately end in depression, anxiety, and the ultimate sad decision around town. So, yes, I understand that the government have said they're going to put all of this money into addressing this problem. It's actually not the money. The money has come too soon. What we need to be doing, and need to be doing quickly, is investing in an actual plan. What is the plan?
So you want a commission, and you suggest that there could be two commissioners, including a Māori commissioner. Are you standing by that? You want that?
Absolutely, I'm standing by that. We have had 2 years of discussion and talk. We've had a mental health and addictions inquiry that spurted out a range of recommendations, and yet 2 years ago, and I remember sitting down with David Clark, the minister, at the beginning of his ministry and outlining that suggested approach. It was a very simple approach. In order to get change within the system, let's set up that mental health commission. To enable us to set that up, we need to make amendments to decouple the Director of Mental Health Services out of the Act and create a new organisation. That could have been in place now 18 months ago. Now, that has not happened. Now, having a Māori Commissioner of Mental Health is also very much about targeting investment and targeting focus on Māori-led and co-designed programs of work that relate to our people and our communities, because we do have a very, very high suicide rate.
Right. You have also said, Matthew, there's a bit to get through, but
I get passionate.
I can understand that. So you would have heard the Prime Minister saying, with regards to setting a reduction target for suicide, she is not a fan. You want a zero tolerance policy, which in essence is a target, but it's a reduction to zero target.
Yeah, let me just explain that point. I am with the Prime Minister. I mean, I'm the one that set a 50% reduction target in Australia, for example, a few years back now. And the lesson from that is very clear. It sends the wrong message. What the zero suicide target looks like, though, is within the hospital system. And what should be happening is that no New Zealander should be entering a hospital system in New Zealand and still exit and still end up taking their life. So the zero suicide target is definitely around the hospital system, of which we're able to control the environment. What we also need to be doing is focusing our time and effort on having a look at programs that are fit for purpose for other population groups. So if we have a look at the volume rate of suicide, obviously it is middle-aged white males or Pākehā males, for example. We can do a lot more work in that area. We can do a lot more work in self-delivery and co-design or Māori-led design for Māori communities, and so on and so forth. So it's about having a look at how do we swallow an elephant, not that I advocate swallowing elephants, of course, but how do we have a cross-population group strategy? And that's why I keep on coming back.
How
you
likely,
can put all the money into it you want, but if you don't have a plan, we've got nowhere to go.
How likely are you to get any of this now? Because what have you achieved today? You've just annoyed a bunch of people in government and the ministry that you're trying to get on side.
Well, actually, no. What I've done today, I've aggrieved three groups of people. I've aggrieved a whole lot of service providers that make a huge amount of money from the sector. We're talking about $1 billion industry. Yes, I have annoyed the heck out of the Ministry of Health and obviously some people in government. But my message to the Prime Minister on this issue is it's not about you, Prime Minister. It's not necessarily about the policies you've announced. What I'm trying to say is we have been on a rolling train wreck of suicide data in this country for more than a decade. This is a record level of suicides in the country. It's about the responsibility of those governments that have been inactive on this issue in the past, but it's also the responsibility of the current government to let's do something. Now, what does that look like? Do we keep on sticking to the same old narrative? You know what? If I hadn't have done what I did today, we would have got to tomorrow, and we would have seen a whole lot of written narratives around, no, we're going in this direction, we're doing this, we're investing that. Look, we've been here last year. We were here the year before. I'm probably going to be one of the most unpopular people in New Zealand today. But you know what? 3 of those number in that data are my family. They're my cousins and my nephews. Now, imagine the pain of people like me sitting and watching glib statements and people promising us that things are going to change when we still see our kids dying from preventable situations, and yet somehow I'm the bad guy. I'll take the bad guy if it means that not one more of my whānau is going to take their life, Lisa. Sorry.
No, don't be sorry, Matthew. I'm so sorry to hear that. And we appreciate you coming on this evening to talk to us about this issue, which clearly is so close and dear to your heart. Thank you.
Thank you very much.
And that is Matthew Tukaki joining us there from our Wellington studio. He is the man that broke the embargo today on those suicide rates and published them ahead of the ministry's announcement.